It is now my pleasure to kick off our series of interviews with Dr. Susan Pinney, who is a professor in the Department of Environmental Health at the University of Cincinnati. I know you're going to find Dr. Pinney's topic particularly timely and very important. She's going to tell you how to protect yourself from the coronavirus. Dr. Pinney.
Thank you, Dr. Lauer. Yes, it's important for everyone to protect themselves from the coronavirus and the disease it's called COVID-19, but especially for breast cancer patients. So coronavirus got its name because of the appearance of the virus. And if you look at the virus under a microscope, it's very interesting. It really has a very striking appearance. And all those red formations on the surface of the virus are supposed to look like crowns. So corona is crown, and that's how it's got its name, from all those projections from the surface. So people with breast cancer may have a higher risk of severe illness if they get COVID-19. Actually, the chances of being exposed to the virus are no different than for people without breast cancer, but the risk of getting really ill is much greater for most breast cancer patients. As you know, some breast cancer treatments certainly can weaken the immune system. We call that being immunocompromised. But things like chemotherapy, targeted therapies, immunotherapy can weaken the immune system. So that's why people who have had breast cancer may be especially at risk. Another reason is if the breast cancer has metastasized to the lungs, certainly then the lungs are more susceptible to severe lung problems if the person has COVID-19. So how do you protect yourself? Wear a mask. Now, you've probably seen the traffic signs, mask up. And that's what we all need to do, but especially people with breast cancer. So masks protect others, especially from your respiratory droplets and aerosols. And as you can see in this illustration, the person who's talking or singing or coughing is going to be emitting both droplets, which are larger particles, and aerosols, which are tiny, tiny particles. So the droplets travel a certain distance, and the aerosols, which are the tiny particles, travel further. And the fellow there with the white shirt, the aerosols are traveling to him. So we can protect ourselves with different kinds of respirators. A special situation is if you wear glasses, like I do. And when I first started wearing a mask, it's frustrating because your glasses get all foggy. So here's what you do. You make sure you have a mask which has a nose wire. You first put on your mask and pinch it so it really fits well around your nose there. And then you put your glasses on so the lower rim of your eyepieces actually is on top of the mask. And so that's the best way to prevent fogging of your glasses. If you wear contact lenses, you may want to consider switching to glasses because until this is all over, because putting contact lenses in and out really gives you the potential of exposing your eye to the coronavirus. Another thing to avoid is public transportation, especially buses and such, because there are many people in an enclosed space. So that facilitates virus transmission. So another thing I like to talk to people about is who's in your social bubble? What's in your bubble? So we all have bubbles. I work with a research team of about 6 people. So they're certainly one of my bubbles, the 6 of us, because we work together, we stay socially distanced, but we see each other every day we're at work. Your family members, your immediate family that you see frequently, they're in your social bubble. Obviously, anyone you live with is in your social bubble. And I think an interesting exercise is to count the number of people that you encounter that are in your social bubbles. I've had people take a stack of pennies and count how many people are in their social bubbles. It really varies quite a bit. There's a wonderful chart that has been put out by the Texas Medical Association that lists, ranks behaviors for their risk of being exposed to coronavirus or contacting COVID-19. And I'm sure you can't read this, but we are going to post it so you can look at it. But things of lower risk, 1, 2, 3, or 4, are things like getting restaurant takeout. I was very happy to see that that had low risk. Pumping gas is low risk. And things like playing golf, staying at a hotel for 2 nights surprised me, but that's relatively low risk. And in fact, the same level of risk as sitting in a doctor's waiting room. So all of those are low risk. Let's jump down to the things that are higher risk. Things that are higher risk are going to a bar, going to a sports stadium, attending a large music concert, working out in a gym is high risk, both because of the number of respirations, how people breathe in and out frequently, and perspiration, which can also carry the coronavirus. Another thing, eating at a buffet is high risk. So I think it's a very interesting chart, and some of the things, how they were ranked on the chart, made me rethink what I do.
Thank you so much, Dr. Pinney. I love these slides that estimate the risk of contracting COVID-19. I can tell you in my practice every day I have more than one person who asks me, is it okay to go to the gym, or where can I eat? As we head into this holiday season, one of the things that I'm also asked is it safe for us to have Thanksgiving dinner? Do you have any thoughts? Is it related to your bubble size, or what's your thought on how best to answer that?
Well, for me, it is related to bubbles. So I think to think about first, who's in your family bubble, if that's who you're considering inviting, and who isn't currently in that bubble. Is it safe to invite them? And how big are your other bubbles? Mm-hmm. And how many other bubbles do you have? And how many other bubbles you have and how big they are really speaks to how much you are a risk to other people. Mm-hmm.
I also know that many patients today are very concerned about contact. I think as this pandemic has evolved, we've learned that this is basically a respiratory virus. And although contact and sanitization is very important, it's probably not quite as important as us distancing and wearing our mask. Do you want to comment on the likelihood of contracting COVID from opening the mail or things of that sort?
It's actually very low. What you can do if you're concerned about that is just set aside your mail for a day or two before you open it. And the virus can't live on a surface like your mail for more than a day or two. What I become concerned about is people who think they can eliminate their risk just by disinfecting. But that is definitely not true.
So as the winter months approach us, we're going to have more trouble, I think. Now it's so nice to be able to go to a park with a friend and sit on a bench and have a lunch that we bring. We're not going to be able to do that in January and February. Do you have thoughts on how we can make that work? Is it going to be number of people within a space, or what would be some general guidelines?
Well, inside is always a higher risk situation than outside because you're in an enclosed space.
What about flying on an airplane?
I would not recommend that. I think some recent studies have shown that certainly coronavirus can be transmitted. You can become exposed on an airplane. That said, the risk is probably less than having, 4 people in a car. Because airplanes have very efficient ventilation systems, but neither is great. You really, especially if you're someone who is immunocompromised, you want to stay far away from both. Choose an airline that keeps the middle space empty, or if you end up seeing that the middle space is taken by someone, a lot of airlines will let you rebook another flight.
Dr. Pinney, I'm going to be asking each of our speakers throughout the months of October and November 2 questions. And the first is, have you seen any silver lining in your life, personally or professionally, because of the pandemic? Has it brought something of positive note to you?
One thing is that, well, actually 3 things. One thing is that without having to commute, and my commute time both ways is about an hour and a half, gave me some extra time. I find I'm more rested because working at home is more relaxed. It's not slower. I find that I have to be more organized to work with my research team, so we're all working together and we're communicating what we need to do, and sometimes dropping off materials and picking up materials. Also, it's made me focus some more on family and activities around family.
My final question is, as an epidemiologist, and I'm using that word because that pandemic sort of comes in there, do you have any predictions for us as to how long you think this COVID-19 pandemic will last?
Well, the closest to normal will return when a large proportion of the population is vaccinated. I think at this point, the earliest would be sometime late in 2021.
I think we're all learning how best to maintain the new normal within this pandemic. And I thank you so much for information about what's low, moderate, or high risk of exposure. So thanks again. If you enjoyed today's video, and I certainly hope you did, please pass along the information using your social media to family or friends or acquaintances. We look forward to joining you again next week when we will have a talk by our breast imager, Dr. Wahab. She is a UC Health physician and an assistant professor in the Department of Radiology, Division of Breast Imaging. And Dr. Wahab is going to talk to us about continuing mammography during the pandemic, updates and safety measures. Thank you.